Welcome to my educative channel. I'm Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. I developed new procedure for facial rejuvenation, no invasive procedure for facial rejuvenation. From here to here, I never remove skin. I do not leave scars. Today I'm going to talk about conventional blepharoplasty versus my personal technique. For me, the new paradigm is the old technique left scars and accelerate the aging process. The new paradigm is do not leave a scar. I'm working in the expression of the face. This is the way we getting older. For me, it's more important the eyebrow ptosis than the flaccidity of the skin of the upper eyelid. You can see in the aging process all this person looks sad, tired and old. The conventional blepharoplasty make the same with the skin resection because pulling down the tail of the eyebrow. All these patients, the aging process was the down position of the tail of the eyebrow. The skin resection of the conventional blepharoplasty produced the same in this young patient. Nowadays, all around the world, plastic surgeons perform this technique, this resective technique. Also today in the Mayo Clinic are suggesting this technique. This picture was taken from internet. It was published like the most advanced laser blepharoplasty, but with laser the only thing that are producing a resection of the skin. But this big resection of the skin accelerates the aging process for the same reason. Ambroise Paré in the 1678 described the excision of the upper eyelid and emphasized the importance avoiding the over resection. I do not resect the skin at all, and just I rejuvenate the skin. This is the laser blepharoplasty, and you can see a big resection in this area. Like this young patient with this big scar that pulling down the tail of the eyebrow. This patient that come to my office after a blepharoplasty with this face tired, sad and old because pulling down the tail of the eyebrow. The same patient with a scar, and this patient come from outside, ask me a reposition of the tail because he so tired and old after the conventional blepharoplasty. Also, you can see a sunken upper eyelid that is produced during the aging process. This picture was taken from internet and published with very good results. But you can see the expression of the face is tired and sad after the procedure. Also, this patient looked tired and old after the procedure, and they are presented like wonderful results. Here the same, the expression of the face is sad, tired and old. Here is the conventional blepharoplasty, is the resection of the skin and muscle and resection of the upper eyelid fat pad in this way. I remove the upper eyelid fat pad through a stab incision that have no stitches. I do not resect the skin at all, and I rejuvenate the skin. Here you can see laser that promote laser technique, but they only cut the skin with a laser, and this is what I'm performing. My idea, what I perform, is like you see here, not resect the skin, just rejuvenate the skin with carbon dioxide laser. I performed this technique since 1994, was presented in many plastic surgeon magazines, and I have the recognition from my peers around the world. Many medical doctors come to my clinic to learn this technique, and also receive patients from all around the world looking for this procedure. Here, my concept is we're not getting older in this area. We have wrinkles all over the face. I think in the same procedure, we must rejuvenate the full face. My patients are happy to get a full facial rejuvenation in one procedure. I do not think it is possible to rejuvenate the face at this moment if we don't use carbon dioxide laser. Then I rejuvenate all this area with carbon dioxide laser, but also I develop a technique to reposition the tail of the eyebrow without resecting skin, just with 3 minimal incisions that these scars are invisible. Here you can see 30 days after the procedure, the patient with the reposition of the eyebrow without skin resection, also rejuvenation of the skin. You can see this is completely different than the conventional blepharoplasty that resect the skin and pulling down the tail of the eyebrow. Again, I think when you resect the skin in the upper eyelid, plastic surgeon accelerate the aging process. This is my technique, the full rejuvenation, and also the laser improve the upper lower eyelid and the skin of the face. This patient was operated the conventional blepharoplasty, and you can see a sad anti-expression, also a lot of wrinkles. Come to my office looking for a better expression of the face, reposition of the upper eyelid, and laser rejuvenation, no skin resection at all. Young patient, reposition of the upper eyelid and laser. And this patient was operated in 1998. You can see the reposition, and also you can see the expression of the face is happy, younger, rested, and here is the opposite. It is impossible to rejuvenate the periorbital area if you don't use carbon dioxide laser. Young patients, the expression of the look. This patient also was operated conventional blepharoplasty, and you can see the descension of the eyebrow with this technique that must be avoided at all. And also the conventional blepharoplasty is impossible to rejuvenate all the wrinkles in the periorbital area. The conventional blepharoplasty leaves an open eyes that is dangerous for the eyes, for the drying, for the wind, the sun, etc. etc. Here is a reposition of the eyebrow and rejuvenate the periorbital area. Young patients also come to my office that they have an hereditary expression, sad and tired. I perform surgery this process because the patient have not a scar and they look natural. You can see the importance of reposition of the eyebrow, the rejuvenation with the laser, and how the expression of the face changed a lot. This patient was operated in another center, and here come for a reposition and rejuvenation with laser. Another young patient. Here you can see young patient, and this is what I performed. Reposition of the forehead without skin resection, and the expression of the look is completely different. If you compare the conventional blepharoplasty with this, you are going to see a completely different of the looking. As I show you all these pictures with the plastic surgeon removed the fold and gave the patient a sulcus, but pulling down the eyebrow and the expression of this conventional plastic surgery accelerate the aging process. Meanwhile, with this, improve the looking of the patient. This is also an hereditary patient from the north of Argentina and Bolivia and Peru. This is a racial hereditary like Asian patient, Mongolic patient. Okay, this is what I done. This the difference between the conventional old blepharoplasty that from my point of view must be avoided completely. I received the congratulations for the most important medical doctors around the world. What happened with this technique is like plastic surgeon, we receive training in general surgery, reconstructive surgery, aesthetical surgery, but most of the medical doctors do not receive training in laser technology. I am specialized in laser technology and also in less invasive procedure. If you want to send us pictures from outside, we are going to analyze this picture. We are going to have a video conference. I'm sure you come back to my country with preoperative study performing in your country, and you are going to have, maybe you arrive one day and the other day you are going to operate it, and the time in Buenos Aires generally is 7 to 10 days.